Iris, first of all, tell us a bit about what's planned for today.
It's a meeting. It's definitely a break with the EU, isn't it, when you have a right-wing leader from Austria, a progressive leader from Denmark, and they're here to coordinate with Israel. So that means joint research program. They want to see how Israel's rollout has been so successful. You probably know Israel has vaccinated more than half its population. And they also want to set up joint facilities for the production of the RNA drug. That's the Moderna-Pfizer drug. They are in discussions with Moderna and Pfizer. And I've read in the media that the Austrian Chancellor has actually picked out a place for that. I don't know if it means it will be only produced in Europe or produced in Europe and here as well. We'll probably learn that later today, but those are the plans. I have also heard that what they want, what they're asking Israel for, is the pooling of vaccines. That's the sharing of vaccines with Israel. And I think that you can see that that would be quite a sensitive issue right now.
Yeah, a sensitive issue. Iris, talk to us in a little bit more detail about that sensitivity.
Well, you know, at the moment, Israel is vaccine rich and Europe is vaccine poor. So a pooling of vaccines would actually mean Israel giving vaccines that it doesn't produce, so either giving or selling vaccines it's bought back to Europe. It did start something similar, giving a plan to give 100,000 doses in 20 lots to different countries in Europe, in Africa, and in South America, and that met with a lot of criticism inside Israel, and that's actually been halted to see if it was legally done. So I don't think it would be very easy for Israel to start giving vaccines to Europe in the doses that Europe would require. I think Austria and Denmark would need millions, not a donation of 5,000. And if Israel has enough vaccines to be giving away millions of doses or selling millions of doses, then really the elephant in the room would be, why aren't they giving them to the Palestinians? Just next door, there's a whole population with almost no vaccines. It has an impact on them and a health impact back to Israel. So I think that would be Israel's focus before it could be donating millions of vaccines to the continent of Europe.
Iris Makler in Jerusalem, thank you very much indeed.